our channel. Thank you so much for joining in Diabetesdocke KE. We are so happy to have you today. So my name is Dr. Hilda Nabiswa, a diabetologist based in Nairobi. And today we have a guest on set. Daktari Karibu, please introduce yourself.
Asante sana. Dr. Tim Theuri.
Yes.
I am a dental surgeon by training, also by practice. I am the president of the Kenya Dental Association, and I'm a practicing dentist in this country.
Congratulations, Daktari.
Asante sana.
And Karibu.
Thank you.
So this channel, we just aim to educate people who live with diabetes or who have people who live with diabetes, and even doctors who are taking care of diabetic patients, so that we just learn together how we can take better care of our patients.
And even doctors with diabetes.
And even doctors with diabetes, exactly.
Yeah.
So, Daktari, tell us, why is oral health important in diabetes?
It's important because we see oral manifestations of the disease, that is diabetes, and there's been shown correlation between oral diseases and the impact on diabetes. I don't know how much you discussed in the channel, but top of the effects that diabetes has on the body, of course, is on the vascular system. That is the blood vessels, the neural system as well, and those micro changes and the alterations that happen at the molecular level, if I may say so, on different parts of the body. So now for oral health, we'll basically be talking about the mouth, structures around the mouth, and their impacts. The impacts of the disease on those structures. Okay. So generally what we see is, of course, like any doctor, as we're taking our biodata, we'll ask you, do you have diabetes, do you have hypertension, have you experienced any other chronic disease, asthma, blah, blah, blah. So if you pick diabetes now, you pay a little more attention. But what I have seen and what we advocate for outside of the practice, even as an association, is that there should be a very good working relationship between oral health practitioners and practitioners of general health, that is doctors. And speaking to this, we saw last year oral health integrated as part of the NCD Alliance, and the 4 diseases, that's cancer, diabetes, hypertension, being the things that are being brought out. Now, for diabetes, we will see increased incidences of dental caries, that is dental decay. You will see that we have xerostomia, that is reduced production or decreased production of saliva. We will have gum disease, what we call periodontal disease. We will have what we call the burning mouth sensation. We will have infections that happen. We will have poor wound healing among diabetic patients, and we will also have altered taste sensation because of the neuropathic effects of diabetes. And you will see that all this will have a counter impact on diabetes, because these patients will not eat well, so they will have poor glycemic control. They are not able to taste things well, so of course quality of life is impacted. But now, how do you pick these things? What are you supposed to be looking out for? So of course, someone will say they have diabetes. Those who know. Those who don't know, you will see gum disease that you can't tell the etiology or the origin of this disease. And this will present as reddening of the gums. When you take an X-ray, you have what you call increased vertical bone loss, shaking teeth, dental caries. This is dental decay. So they will have what you call holes in their teeth, or the black spots in their teeth, active decay. Reduced production of saliva. And the reduced production of saliva, of course, is because the exact reason is unknown, but what we postulate it to be is that the basal membranes of the glands are affected. The microvasculature of the glands is also affected.
Macrovasculature is? Some of the patients don't.
So, and that is the small
vessels.
Blood vessels that supply the glands, and generally also in the mouth. They are affected by diabetes. So, the things that I will be mentioning would fall down to those two main reasons.
Yeah.
Right? And that will be what will be responsible for the reduction in saliva. So what does this lead to? So we look at what does saliva do in the mouth. It has a buffering effect. That is, it maintains the pH at a constant level. The normal bacteria that we generally find in the mouth is also maintained at a particular level, at healthy levels. So when you have a decrease, then now these changes begin to happen. So you will find the bacteria colonies will increase. So it means that they are acting on the food debris that is left in the mouth. The byproducts of those are acidic, and now decay begins to happen. Fungal infections, the likes of Candida, you will find about research shows more than 20% increase in fungal colonies in patients with type 1 diabetes. And this now will lead to other things. Lichen planus, that's one of the diseases we see. And now oral candidiasis, which is an opportunistic infection. And of course, that is easily treatable. But the effects of that, again, it could spread very easily to the oral pharynx, and you know what happens after that. For periodontal disease, that is now what we call gum disease. The small blood vessels that nourish the gum become affected. So how the gum responds to perhaps traumatic events, the increased bacteria presence is a bit different. Because we also know diabetes affects some of the disease-fighting cells in the body. That is the neutrophils, I believe.
The white blood cells.
The white blood cells, basically. So the body's response to infection is altered. So disease goes up. And this has also been shown to have some correlation to heart disease. For expectant mothers, we have seen a correlation with reduced birth weight for the children who are born. So it is not only things that we see in the mouth, the effects are far-reaching.
They are far-reaching. Interesting.
Response to wound healing. Say you suffer a wound in the mouth, you are eating, you beat yourself, or you're involved in an accident. So patients with diabetes will heal a little less faster
than
most people.
Okay.
And you want to take care of that as a practicing dentist. You want to know that if I do this procedure, what do I expect? What are the risk benefits analysis of that? You're doing an extraction. What advice do I give this patient? They're supposed to take a little extra care because the duration of healing is not the same. Do you want to cover them with some antibiotics? Given that they may have higher bacterial concentration than the normal people outside them. So that's basically what you see. Also, these patients have also been shown to have higher carbohydrate content in their saliva. So it means that the bacteria also have more substrate, or what they use
to feed on,
to metabolize, to keep themselves going is a little more. So you will have more bacteria within the mouth.
Interesting.
So that's basically what we generally see. And one of the signs is these patients also have what we call a ketoic breath. That sweet smelling breath that you can't exactly explain. So halitosis, it's not exactly halitosis, that is the bad breath, but it's something you can pick up.
Okay. Interesting. So, Doc, I can see we have a model of some teeth here. So, what advice would you give a patient when what should they look for in their mouth?
So, what you're looking for are those things that I've said, and these are things you generally see. Dryness of mouth. So, how does it appear? The tongue will be shiny, and it's what we call the geographic tongue. For some people to manifest as that, we'll have what we call angular cheilitis. That is the wounds that you see at the corner of the mouth. Stomatitis as well. What is the other one that you can see? Rhomboid glossitis.
But for the patient.
So for the patient.
For you, you'll say that, but what should the patient look out for?
So what they're looking out for is, one, dryness of mouth as one of the signs. your gums will not be this coral pink color, and that is loosely used because in the African population, our gums are colored. So you will want to see some reddening around the gums. That's what you're looking for. You're also looking for loose teeth here, teeth that are shaking. That's what you're looking for in this kind of conditions. When the gum disease progresses to be a bit bad, the gum level also will reduce.
Okay. So the tooth ends up being exposed.
Yeah,
kind of.
It's you have low teeth.
Low teeth.
Yeah, that's what you see.
Yes.
And the crown part of it now becomes different from what you can see in the root, and they have higher chances of what you call root caries or root decay, which is generally something you don't see. Yeah.
Okay. Interesting.
So those are the things you look out for. Little wounds that are not healing. You're also looking for that burning mouth sensation because now we have reduced saliva in the mouth. The inflammation is just not going away. You're also looking for white patches within the tongue, the cheeks, perhaps indicative of candidiasis, and lichen planus. That is now for us on the technical side of things.
Yes.
Altered taste sensation, you're also looking out for that. So how they taste the sweets and the sours is what has generally been shown to be a bit different. But then again, the jury's still out on that. That ketoic breath, that sweet smelling breath in patients with poor glycemic control is also what you're looking for.
Okay. Yeah. Thank you so much, Doc. Where can people find you?
I practice dental access clinics both in Nairobi and Kilimani.
Yes.
Of course, through the association for any kind of interaction someone may need in the oral healthcare space, because we are key industry stakeholder. On the social medias, Tim Theuri for Instagram, Twitter, LinkedIn, Facebook.
Okay. Tim Theuri. Okay.
Yeah.
Thank you so much, Dr. So as usual, you know where to find me. My YouTube channel is here, and my other handles: Instagram, Diabetesdocke KE, Diabetesdocke _KE on Instagram and on Twitter, and on Facebook, Diabetesdocke KE. So thank you so much for joining us today, and have a lovely week ahead. And remember, keep your teeth healthy and keep your sugars within target. Bye-bye.
See you. Thank you, everyone.